All right, let's take a look at some pulmonary anatomy. So here we have the bronchial tree, and we've got start off here with the voice box, otherwise known more technically as the larynx. So the larynx contains some cartilaginous structures as well as your vocal cords, denoted here by the V. The space in between the V is called the glottis, and that forms the superior most or the proximal aspect of your trachea. So the trachea has cartilaginous rings that allow it to stay open. They're C-shaped, and trachea comes down here through the thoracic cavity, and we split into the right lung and left lung, and specifically this is the right mainstem bronchus, left mainstem bronchus. You'll notice this angle here is a little more obtuse. This angle here is a little more acute. So that's one thing we need to be cognizant of when you're intubating your patients, because you might more frequently accidentally intubate the right mainstem bronchus if you advance your tube past the carina here, so past the split. So keep that in mind when you're intubating your patients. So right mainstem bronchus, left mainstem bronchus, because of course our patient is in anatomical position, patient's right, patient's left, until noted otherwise. The bronchial tree gets smaller and smaller, airways get smaller and smaller, and now we have bronchioles, and at the very, very end, we've got these air sacs. They're called alveoli. Alveoli is plural, alveolus is singular, and they are literally one cell thick air sacs. So these, again, are simple squamous cells. Simple means one layer. Squamous means flattened cells. So it makes it very, very easy for the oxygen that you inhale to travel down your bronchial tree, get concentrated in the alveolar space, and now you have a higher concentration of oxygen on one side of a semipermeable membrane than the other, so the oxygen will diffuse through this layer of simple squamous cells into the pulmonary capillaries, and then will be transported back through the capillary circulation, pulmonary circulation rather, back to the left atrium of the heart to be pumped to the left ventricle and throughout the body. Conversely, we have a high concentration of carbon dioxide in the pulmonary circulation at this point, and because this has been pumped out to the lungs by the right ventricle through the pulmonary trunk and pulmonary arteries, right and left, and because we have a high concentration of CO2 in the pulmonary capillaries, it will then diffuse into the alveolar space and will then travel up your bronchial tree, and you will exhale carbon dioxide. And again, that will be evident with end-tidal CO2 detection.